Welcome to 4D Sports. My name is Jair Fori, and my guest for today is Nadine Waeghe. She's a physical therapist and an athletic trainer. We will be right back. Hi Nadine, tell us a little bit about you. What is it that you do, or what are the differences between physical therapist and athletic trainer?
Great question. Thanks for having me on today, Jair. So physical therapist and athletic trainer, very similar job, but there's a few slight differences. So I actually went to school in undergraduate and studied pre-med biology with the intention of going to med school, and then decided against it and worked as a student athletic trainer for our athletic department and decided that I really liked that, so wanted to be an athletic trainer. Through that, back in the day when I was in school, it wasn't necessarily a specific degree in athletic training. So I just worked and took all the classes that were related to that. And then I could have pursued a master's in athletic training, but I felt like I really knew what I was doing in terms of sports for the most part, so decided to go for a master's in physical therapy. Athletic trainers really specialize in treating sports injuries and athletes, at least back then. Now they've branched out and really can cover all kinds of different fields of occupations in different areas besides sports. And physical therapists kind of work more specifically on the rehabilitation of injuries and helping people restore their function after injury. Athletic trainers also do that, so they work a lot with rehabilitation of injuries, but athletic trainer is also there as the first person of contact. So for instance, at a sporting event, if a soccer game, perhaps, since you're a big soccer guy. If an athlete were to go down on the soccer field with a knee injury, the athletic trainer is the one who's on the sideline who would run out to see the athlete on the field, assess the injury, get them off the field, and start with immediate treatment right there. Directing care if they need to see a doctor, perhaps to go in and get an MRI, figure out what's going on with the knee, and then kind of coordinating the health care for that athlete from the point that they actually got injured all the way until they're back on the soccer field, completely rehabilitated afterward. So athletic training is a little bit broader than physical therapy, and it includes some physical therapy, but not necessarily all of the same detail that a physical therapist does. So a physical therapist can actually, really work typically more in a clinic setting, sometimes in a sports arena, and really focus a lot on the treatment for the injuries and rehabilitating or strengthening the body parts to get them back to their activity level. Athletic trainers do the same type of thing, but they focus more on sport-specific skills or activity skills. Physical therapist looks a lot more at lifestyle, really spends a lot of time maybe more with hands-on stuff, manual therapy, doing a lot of joint mobilization or activities where they're really helping with their hands to get the injury a little bit better. So slightly different, but very similar, and they work really well together. And for me, I wanted to be a really good athletic trainer. So that's why I went to PT school, so that I would be able to do some of the hands-on treatment that I didn't learn as an athletic trainer.
And it's amazing. Well, now that you're talking about these things, for me it's very interesting because many people out there don't give the appreciation to your profession as they should be. Because just like you said, if you're on the field and an injury happens, you guys are the first one out there. Mm-hmm. And so what would that say, for instance, of a program that doesn't have physical therapists within their facilities?
So you mean an athletic program?
Or athletic program,
sure.
Yeah.
So if you had a sports club or a sports organization and you were out practicing with your athletes every day and you didn't have an athletic trainer or a physical therapist or medical personnel on site, it's a little bit risky because in every sport there's a risk for injury. So having an injury occur and not having somebody there to immediately take care of that athlete, depending on the extent of the injury, it's a pretty big risk. The athlete could have a pretty significant or a serious injury and it takes too long for medical care to get there. If you were to call 911, there could be, something pretty significant there. Or the coach may look and say, okay, well, do you feel okay? Well, then get back in there, and then an athlete may try and continue competing on an injured body part when maybe they shouldn't. So having that athletic trainer there to help is really kind of about safety and precaution, reduce the risk for actually compounding an injury, making it worse, as well as providing that immediate care. If you're, let's say, at a soccer field again, when you're out there with your club and you're at practice, and somebody goes down with a knee injury, and the coach looks at it, oh, I think you hurt it, maybe you should sit out for a little while, put some ice on it, and the kid sits there for the next hour and a half of practice without really having any treatment on that. It's not the end of the world, but they could be better off if they had immediate treatment on it. And then let's say he goes home that night, if it's a high school age, goes to bed, tells mom in the morning, my knee's a little stiff still, tries to go to school, it's still really bothering him. It may be 2-3 days before they actually get somebody to look at it, and it could be a pretty significant injury that needed immediate care. So there's always that risk if you don't have somebody to look after your athletes in the moment.
And just following that, I mean, you there on the field, you make the diagnosis, the diagnostics about the problem that the athlete might have. And then what happens then? I mean, I know that you have to work very closely with the coaching staff to create a recording program.
Absolutely. Yeah, so kind of to give you just the rundown of what happens from the time they're injured until they return to play. So we'll stick with the same scenario here, a soccer player with a knee injury. So let's say somebody goes down, I run out on the field, I'm going to do a fairly quick assessment because I don't want to delay the game for too long. So I'm going to kind of look at it, okay, are you able to get up? Let's hobble him off of the field and onto the sideline. Then on the sideline, I'm going to go ahead and lay him down and do a really more thorough assessment to determine what's going on in the knee. And let's say that the injury is an Acl tear. So the anterior cruciate ligament, which is the main stabilizer in the knee. So I do a little test, a little Lockman's test on the knee, and I say, okay, your ACL feels really loose to me. I think you may have torn it. So immediately we're going to probably bring that person inside to the clinic or the medical tent that's at the game or whatever area we have there, and get some ice on the knee immediately, possibly some electrical stimulation, which can also help kind of control pain and inflammation in the knee, and then start a plan immediately. We're going to let the coach know this guy's out for the rest of this game. We'll know more tomorrow. You can plan around it. And then get on the phone with a doctor, or hopefully there's a doctor nearby, really kind of giving a good assessment, possibly then within the next day or two arranging for an MRI, so a diagnostic test to really see what's going on inside the knee. If the knee were a full rupture of the ACL, then they would probably have to have some surgery, and typically surgery within the next 2 to 10 days is pretty typical, sometimes a little bit longer depending on the athlete and the situation. And if it were just a sprain, let's say it just got stretched but didn't actually tear, then you're going to start basically with rehab right away. So whether they have the surgery or the tear or the sprain, you're going to start with some treatment. So treatment kind of on a daily basis. You want to control the inflammation so that it doesn't get out of control. You want to reduce pain, and you want to restore function. So some hands-on stuff to help get the swelling out, a little soft tissue work, massage to help get the muscles to relax because they're trying to protect the knee. And then getting started with exercises, range of motion exercises, trying to get the knee to actually bend and straighten the full amount so that you can walk normal and run normal and play normal. And then some strengthening stuff, trying to work to get the muscles in your legs stronger, as well as continuing to maintain some upper body and core strength while you're going through that process. You also work on some neurological stuff on agility, coordination, getting the muscles to fire the right way, kind of resetting the signal to the brain and teaching yourself how to walk again normally without limping. So there's just a lot of that kind of retraining and whatnot. So really an everyday basis, working with those athletes to get them back to the full strength, full mobility, able to get back on the field and run again. And with an injury like an ACL sprain, it may take anywhere from 4 to 6 weeks to kind of get a little bit better if it was just a mild sprain, or you're looking at close to 8-9 months if they actually had surgery, reconstructive surgery, and then go through rehab before they're back on the field again. So.
Now that let's move forward 9 months.
Yep.
The kid is back. So what are the precautions that we need to have in order to play that individual on the field?
Yep, great question. Excellent question. If they actually completed rehab and they took the full time to really get back so that their strength is at 95% or better, then there really shouldn't be any precautions necessarily for them. You know, they'll be a little bit cautious at first as they return to the field, but they really should be fine. What we see happening more often is that an athlete's really anxious to get back. So at 6 months, okay, well, it's pretty well healed. I feel pretty strong. They're maybe 80%, 85% better, and so then they go back on the field. But then the graft, if they have the surgery, maybe hasn't healed really completely, and so they're a little bit higher risk to injure it again. And the same thing even with a sprain. If they come back a little too early, there's just a little bit of a weakness there still, or an imbalance. So perhaps if it was their right knee, maybe their right hamstring is still weaker than the left. So now they're a little bit imbalanced when they're running and cutting on the field, and so then they're at risk to maybe fall or tweak their other knee or sprain an ankle or something like that. So really at that point in time, it's better if you don't come back to sport, really finish your rehabilitation and get all the way strong. But when they do come back a little bit early, sometimes they wear a knee brace just to kind of help protect and give that little bit of feedback. And sometimes it's a matter of, you know, a tape. Very rarely do we tape after a surgery or something like that, but that may be the case. You know, or it's come back really gradual. So it might have been a starter that played all the time, and so maybe for the first month they're back, they're only going to play 2-3 minutes in a game until they get a little bit stronger and better.
Oh, wow. That's nice to know, because I mean, what we don't want to do is for people to just send those players out there to get injured again and have another surgery there.
Yeah.
But you were talking about balance on the muscles, so that leads me to biomechanics.
Yep.
Can you talk to us about biomechanics and what is biomechanics used for?
Sure, great question. So my area of expertise actually is biomechanics, so it's very easy for me to talk to you about that. Biomechanics basically is looking at the relationship between all of your body parts. So what's happening at the foot, how does that affect what's going on in my shoulder or in my hip, and the relationship between all of the different joints in the body, and the balance and the symmetry between the muscle strength, the mobility, the stability, and the movement patterns. So one of the things that I look at with all the athletes is how do they move? Are they efficient in the way that they move, or do they do some extra movements, or do they miss certain things that are considered normal movements? And then really trying to figure out the puzzle, basically, of what's going on with them. So if we want to kind of stick with the soccer kid with a knee injury, and we're looking at that, I would really look at the way that that athlete is walking, the way that they're running, the way that they cut, and see if they're doing it efficiently, like the shortest route to get there kind of a thing, or if they do some extra movements that maybe is a waste of energy or puts them more at risk for injury. And also really looking at their biomechanics helps show these muscle imbalances. You can't cheat. You know, if you cheat and you've got someone that knows what they're looking at, we're going to pick it up. So interesting, one of the things I do with my athletes is it's called a functional movement screen, and it's this assessment tool that we use to determine risk of injury. So it's 7 movement patterns that are considered standard movement patterns for human beings. So if you've got all your working body parts, arms and legs work, every human being kind of knows how to squat. And no one ever taught you how to squat, but you know how to squat down. And most human beings know how to do like a lunge if they're going to pick something up. So those are movement patterns that are considered fundamental. So this assessment tool looks at 7 fundamental movement patterns and how the body moves. It was originally tested on thousands of athletes just to kind of see what was typical or normal movement patterns, and so there's certain things that you look for to be considered normal. If you don't do it quite right, then you don't get as high a score on that test, and it increases your risk for injury. So I use that tool a lot to show my athletes that they're not as good as they think they are. But for me personally, because I know biomechanics, I can watch someone walk across the room once and back, and I can tell them all the same information. I can know immediately by the way they walk if they don't use their core stability muscles, if they've got a shoulder injury, if they've got some stiffness in their low back, or maybe their ankle was injured at some point in time and they've never told me that. I can tell that by the way that they walk, because I understand the way the body compensates in biomechanics. So I look at that stuff really closely because it helps me figure out the puzzle. What do I need to do with you to get you better, to get you working more efficiently on the soccer field or in your sport, so that you can actually be more successful, perform at a higher level, because you're actually not wasting any energy, but you're doing the movement the most purely efficient way that you can.
Well, and I guess that's basically one of the main reasons why you went from all of this to the professional tennis or league.
Yeah.
Because I mean, you're an outstanding trainer and physician, basically. You know what I mean? And I want you to tell me about two things. One about tennis, and the other thing is about prioritization.
Periodization.
Yeah, how they merge. I mean, in terms of biomechanics, rehabilitation, and getting prepared for competition and all of that.
Okay, I'll tell you a little bit about tennis. So I actually worked for the WTA, Women's Tennis Association, for almost 8 years. Full-time, I worked as a contractor for them prior to that. Through a friend of mine who's also a physical therapist and athletic trainer, she had met somebody and ended up getting a job offer to work in tennis. And when they hired her, they said, do you know anybody else that can do this job? And so she gave them my name. So they actually called me, and I started talking to them a little bit. And they're like, "Well, what's your specialty? What do you look at?" And I said, "Biomechanics." So I did a little bit of contract work for them, and they liked me. Thought that I was pretty good. The athletes seemed to respond well to me, and I was looking at things a lot different than a lot of the other physiotherapists, athletic trainers that had worked for them. So they asked if I would run their biomechanics program and kind of enhance it or grow the program. So for 7.5 years full-time for the WTA, I worked as an athletic trainer and physical therapist, treating the athletes on the tour, but then I also worked in the office growing the biomechanics program.
Wow.
So it was pretty fun. I enjoyed it. I got to travel a lot, which was really interesting, and work with elite athletes. So that was, also really fun. And then I was able to really even enhance my knowledge of biomechanics by working with elite athletes, because then I could really see efficient movement. And when they were injured, I could really see that they weren't playing the same way that they had before. So that was really a great experience for me to get even better at what I do, as well as just working with that level of athlete was fantastic. Related to periodization, while I was there, I worked on a lot of their education stuff. And one of the things that we're constantly doing is educating the athletes. And that was one of the big topics that we were having to do with athletes in a sport like tennis.
No, and that's basically what we have you here on the program, because we
Right.
want you to educate everybody.
Right.
I mean, I'm learning some things that out of the conversation that we're having right now. So what was it like to be working with somebody like Serena Williams and Venus Williams, for instance?
Yeah, for me, it's no different than working with you, to be honest.
Oh,
to be honest, for me, I look at every single human being that comes in to see me for anything. They're an athlete, whether it's a 78-year-old grandma, or a 5-year-old kid. Everybody has the potential to be an athlete, and they're an athlete in their own way. So really, I kind of look at everybody as, what's the puzzle? What do you need from me? How can I help you? How can I make you better at what it is that you want to do? So really, from a personality or from a famous perspective, didn't really matter for me. What was nice about working with someone like the Williamses was just that they perform at such a high level that it was really fun to be able to do treatments and see them respond immediately. They immediately got better and could make a difference. And they could come off of practice and come in with a sore shoulder or low back, do a little bit of treatment with them, give them 2 simple exercises, they do them, and go back out to the court an hour later and have none of the pain and be able to do their performance much better. So I think just the caliber of the elite athletes is that they respond quicker and heal faster to treatment. So that was, for me, the great thing about working with elite athletes. And in terms of celebrity, no, really.
No, I wasn't thinking that
Yeah.
much about the celebrity,
Yeah.
but you know that they're special.
Yeah,
These people are special.
for sure.
And that's why they have won so many different championships. But and you cover that, because it's about how quickly they can recover from a particular injury.
Right.
And how committed they are to recovering. It's not just that, okay, I have an injury, but they really want to get
Yep.
better today. It's not in 2 months, in 3 months. They have to be getting better right now.
Sure.
When you were working for the Tennis Professional Federation, you guys were traveling to different places, and within that, you were going to be hitting basically different environments, the different type of weather conditions, climates changing. I mean, do you have to do something specifically different for every single contest from that perspective?
Sure, that's called acclimatization.
Acclimatization.
Yeah, and that is, it's a great question as well. So with tennis and in the winter here in the U.S., it's cold, so any tournaments that are here in the U.S. are going to be primarily indoor. So they're going to be played on a carpet inside, and it's going to be cold outside. In the southern hemisphere of the world, they're playing the Australian Open in the winter, and it's 110 degrees outside, and they're playing on a completely different surface. And the athletes might go from playing in Australia where it's hot and, somewhat humid and just crazy extremes there, and then come and play a tournament like in Memphis, Tennessee in February.
Wow.
And it's an indoor tournament, it's 20 degrees outside, there's snow on the ground, and there's a big difference between those two things. So we do a lot of education with athletes when they're traveling worldwide, in tennis, but in other sports as well, and it's called acclimatization. We advise them, you want to make sure you get there a few days early, and during those few days that you're there early, don't rush out onto the tennis court or onto the athletic field, but just spend some time walking around the neighborhood, do a little bit of fitness stuff outside, you can go jump some rope, just trying to get used to the environment while you're elevating your heart rate so that you can kind of prepare. And then, maybe on the second or third day you go out and do a light practice of whatever it is that your sport is. So if you have the luxury to be able to acclimatize by getting there a few days early, it helps. One of the areas where we see acclimatization being really important is altitude. You're from Colombia. They have a lot of mountains, a lot of altitude there. So there is a tennis tournament actually in February in Bogota, Colombia.
Wow.
And so you've got girls that are going from Memphis, Tennessee. It's cold and it's winter, and it's sea level for the most part, and then going from there to Bogota and having to play outdoors on clay after playing indoor on carpet, outdoor on clay in high altitude where sometimes it's extremely hot at that time of year. It just kind of depends on the weather pattern. So making sure that they get there early so they can acclimatize to that thinner air in the mountains is really important for athletes who are training in different climates.
But as a professional, what would you be looking for in terms of the athlete? You will be saying, well, this athlete might be experiencing this because it's coming from this low level to a higher altitude.
Sure, yeah, there's certain symptoms with all sorts of illnesses that are related to climate. So you could have altitude sickness, which is a great question. So you really are watching the athletes. They're dizzy, they're lightheaded, they get more tired, kind of sleepy. They maybe have a hard time paying attention or focusing. Their performance will go downhill a little bit. Thirsty a lot, certain things like that. So you can really start to look for that. Difficulty breathing. Sometimes you see bloody noses. Those are kind of things, good examples of altitude. The other thing that you have to acclimatize are temperature differences. So playing in extreme heat, when you're not used to that, you need your body to get used to that hot weather. So we look for signs of heat illness, which are similar. So you get dizzy, profuse sweating, cramping in muscles is pretty common when someone's getting sick from the heat. Sometimes they feel nauseous. Sometimes they get a little blurry vision. And if it gets really extreme, you can get to actual heat exhaustion. They might pass out and have some issues with that. So making sure that you've had a day or two in that hot weather to acclimatize is really important.
Well, and the other part is that we listen to the news and we hear that the national team sometimes they fly the day before or the night, or they just want to get there right at the moment that the whistle is going to start.
Sure.
So what can you tell us about that? Is that something that is common practice or what?
Yeah, that's not unusual. And, if the athlete is playing a sport where they do have to travel a lot, sometimes their body is a lot faster at adapting than perhaps mine or yours. So they can adapt a lot quicker. Flying in like the night before or day of, like early in that morning, it's risky because the athletes are going to be tired. They're going to be slow. They're going to have a difficult time with coordination during play. So when that happens, they typically don't play as well as a team who maybe has been there for a while, or their opponent that's been there for a while. And you can see that happen. So tennis, a great example, maybe the athlete is playing a tournament, and maybe it's a top athlete, and they are playing that tournament all the way to the final, which is on Sunday. The next tournament, halfway around the world, starts the next day, on Monday. Oh, wow. So they've got to finish playing in this tournament in really hot weather, and they're playing the final, and then they have to fly that night or the next morning halfway around the world to play an indoor cold weather tournament, and then be expected to, maybe they don't play that Monday, obviously, because they just flew there, but they have to play that Tuesday. So they didn't have any time to adapt. You'll often see that athlete play horribly or not perform very well. Every once in a while, they're still on that high from playing so well the week before that they can manage it for the first day or two, but it catches up to them, and then they really tank as the week progresses.
And when the athlete is tanking, what would be your recommendations? What's
Great
the first thing that you will
question.
do?
So, we want to make sure you're getting a lot of sleep, a lot of fluid, a lot of water, make sure they're drinking a lot, coming in and getting some massage treatment, some flushing to help clear any junk out of their muscles, lactic acid buildup or anything like that, really getting their muscles more loose, awake, kind of invigorating the body a little bit, making sure they're eating properly, getting all the food groups in there. And really, sleep is probably one of the biggest things that we do to make sure that they're getting enough rest, and then everything that we can to help them enhance their performance. And maybe it's an ice bath, maybe it's a jacuzzi, whatever it is to kind of help get their body really feeling like it can perform.
And what's the difference between one or the other? Jacuzzi, they have the ice bath.
Well, hot and cold.
Yes, hot and cold. But in terms of what makes the determination for you as a professional to say to an athlete, okay, this is what you got to do?
That's a great question.
And which one do you do first?
Also a great question. So
Thank
hot
you.
and cold therapy is, both can be used for different things. Generally speaking, when something is acute, so if somebody had an acute injury or they're just finished playing a sport and they're feeling kind of sore already, heat is actually going to make them flare up and probably feel a little bit worse. And ice is going to help calm them down a little bit more. It's going to relieve some of the pain, probably make them feel a little bit better, help so that they don't swell or have some irritation there. If it's later on, 2 days later, and you've got that muscle soreness from a big workout and you're just kind of feeling tight in general, heat is probably a better option because it's going to help the muscles relax, increase blood flow, and kind of help wash out any of that lactic acid buildup or whatever else might be going on in the muscle, the congestion that you have in there, take away any old inflammation that's gotten trapped in there. So it kind of just depends on the situation. And sometimes you want to alternate. So you've got hot and cold alternating. That helps a lot with recovery as well. So if it's not a matter of injury or jet lag or anything like that, it's just a matter of you want to recover because you've got to play again tomorrow. Great thing to do is alternating heat and cold. So generally speaking, we say to start in cold, go to heat and go back to cold, go to heat, go back to cold. So start and end in cold is typically most often what we recommend, but there are times when you want to end in heat as well. It just kind of depends on the athlete.
And it doesn't matter the time?
No, we usually keep it pretty short. So you maybe do 1 to 2 minutes in cold and then 1 to 2 minutes in hot and kind of back and forth like that. It's pretty tough to stay in an ice bath for very long. It doesn't feel that great, but it feels good at the same time. It's kind of strange. But yeah, alternating is a great way to help with recovery. And that's something that anyone can do at home. I usually tell people, go home and take a warm shower, then followed by a cold shower, followed by a warm shower. Just turning that dial in there. That's one thing that you can do. Another great thing for recovery is an Epsom salt bath. So I'll tell somebody to fill your bathtub with warm water, put some Epsom salts in there, soak in there 5 to 7 minutes, then stand up and take a cold shower. And then let that cold water come in, and that really helps, kind of really flush the body with recovery. And then from there, you can go to hot water and then take a regular nice shower and relax.
Wow, so that's the information that you have provided, Nadine, is very important to not just to me, but to the audience out there. And I mean, an honor to have you here in my program. So thank you for coming. I hope that we can continue to work a little bit more in the future. Sure. But this is 4D Sports. My name is Jair Forty, and I'm your host.